everyone. Welcome to Achieving Success with Olivia Atkin. I am your host, Olivia Atkin. Each week, we will discuss the roadmap of achieving your personal and professional success. We give you real-life stories on growing personally and professionally to achieve your life and career goals with the help of some top-notch guests. Today, we are speaking with Dr. Tracey Milligan. Dr. Tracey Milligan, Chair of Neurology at New York Medical College and Director of Neurology at Westchester Medical Center Health Network. With over 20 years of experience, Dr. Milligan is a leading expert in epilepsy and a champion for medical education. Her impressive journey includes degrees in communication disorders and speech-language pathology, a medical degree from Albert Einstein College of Medicine, and residency and fellowship training at Harvard. Dr. Milligan has been recognized for her leadership in diversity, her innovative Spanish Neurology Clinic, and her dedication to teaching, earning numerous awards for her contributions to healthcare and education. Today, we'll dive into her journey and insights on advancing neurology and fostering impactful change. Hello, Dr. Milligan. It's fantastic having you on the show today.
Hi, Olivia. Thank you so much for inviting me on your show.
I am so excited to dive into your journey, not only becoming a physician and what sparked that, but specializing in epilepsy and just being able to learn so much about such an important medical aspect to me personally as well. To start off the show, can you tell me what success means and looks like to Dr. Tracey Milligan?
Well, what a great question. And I think that it is a personal question, actually, what success means to each of us. So I was thinking as you posed this question, success has to do with achieving certain goals. So it's really tied into what goals that we set for ourselves. And the best goals are ones that are completely in our control so that we're in charge of our own success. So I think that those goals can be small and they can be big, but having the right goals and the focus on the goals then leads to achieving success. And sometimes, honestly, a goal could be just, being grateful for the day. And then if you do that, you've achieved success for the day. But they can be bigger goals too, like, some of the goals in my life, going to medical school and becoming a neurologist. They had a mark that, I got a degree and then I was successful in achieving that goal. So I think it's really about that goal, those personal goal setting, and then achieving that goal.
I like how you say it can look in spaces differently, whether it's big, large, if there is a quantitative mark or not. You can set those yourself as well to know you're hitting them and staying true to yourself as well. As you mentioned, you have, especially in neurology, with a particular focus with epilepsy. And just to give some of my listeners a heads up, because typically when I talk to guests, I always refer to them by their first name. This might be a little challenging for me today because Dr. Milligan is personally my epilepsy doctor. And so I'm so used to calling her Dr. Milligan. I don't know if I'm going to be able to call you Tracey today. So just to give people a heads up, and that's why today's episode is also especially special to me because she's made an impact in my life. And I know I get to see firsthand the impact you're making regularly and touching base with patients, making sure they're aligning with their goals and the goals you set, not just through medication, but holistically as well. So that being said, what made you focus specifically within neurology on epilepsy?
Yeah, so I think that's a great question, and I would like people who have epilepsy to achieve success, Olivia. So that's a way to tie it in. But becoming a neurologist, our specialty in neurology is the nervous system, and part of that is the brain. So who isn't interested in the brain? All your listeners, I'm sure, right? It's just, how could it not be interesting? And when thinking about learning more about people and learning about if they have something that needs treatment, hearing from them about it, epilepsy allows me to find out more from my patients about what they're going through in a way that's very meaningful for their treatment, so that I can spend time getting to know people, getting to know what happens when they have a seizure, the impact on their life, and all of that, which is interesting, all of it then helps me treat the patient better. So it directly leads into helping somebody else do better and get better. So I like that part of epilepsy. And the other part is that epilepsy affects people of all ages and of all backgrounds. It can affect anyone. And so I always say, if you've got a brain, you could have a seizure, you could have epilepsy. And then, some animals have epilepsy too. It really can affect a lot of brains. So anybody could have epilepsy. And so that means that the people that I can care for as a physician specialized in epilepsy, it's a very diverse group of patients. And I really like that. I like being able to, have that experience. And we have a lot of treatments for epilepsy. So that means when I see somebody who's had a seizure or who has epilepsy, I'm talking about why, and I'm talking about how we're going to stop any more seizures from happening. So it's interesting. And then also we've got a great goal. And you've heard me maybe say this goal before. The goal is no seizures, no side effects to medicine, and a great life. And that's the goal in my clinic practice. And I really enjoy that.
And you brought up an interesting aspect I want to highlight, and it's twofold here in what you were saying, is that epilepsy can hit anyone and everyone. And there's a lot of misconceptions I've personally experienced and heard, whether someone knows I have epilepsy or not, of what that looks like and what that means. And the other aspect is that there's multiple different ways to treat it. And there's a lot of different facets that go into it. One of the first discussions when you and I met that you brought up, you listened to me, as you were saying, you very much want to listen to the patient, see what's going on in their life. And you heard my day schedule, and then you said to me, "Are you getting 8 hours of sleep?" And I was like, "Oh, she caught me real fast." No, no, I do not. And I always bring this up to people who are saying they're having difficulty in different spaces. I remember you telling me that. And I always ask everyone, "Are you getting your 8 hours?" No. The next thing Dr. Milligan said to me was, "For next 2 weeks, I don't care what you have to do, get your 8 hours and then report back to me on how you're feeling and see if some of these certain things we're talking about go away." And I mean, she is the best. So what happened after 2 weeks? Some of those things I was experiencing went away and we can focus on other areas. But for you, understanding that every patient can walk in the door with different symptoms, with different, what is different when it comes to epilepsy? Why do you think that understanding that not every seizure is the same is so important, not just for a doctor, but someone who might be experiencing seizures or potentially down the road might have a seizure?
Yeah, so seizures are very different. And even when they look the same on an EEG, people can have different symptoms from them. So it really, because it's, something that happens in the brain, and all of our brains are different. That's why we're different people. It can have these differences. But one thing I'd like to let your listeners know, because a lot of people don't know this, is most adults, when they have a seizure, it's not a shaking seizure. So they can be, I call them sneaky seizures, subtle seizures, or it's just something somebody is experiencing themselves and nobody can tell, or it's more sort of staring off into space and not being as aware of the environment as normal. And those are sometimes hard to diagnose. And so I've certainly seen people have had some of these smaller seizures where they're not shaking, and nobody realizes it until they have a much bigger one. And so probably about half the time when people have a convulsion or a tonic-clonic seizure, about half of the time when I ask them, they've actually had smaller seizures and nobody realized it.
And that leads into a very important aspect for someone who, oh, I should phrase it like this. A lot of people, due to sadly things that get portrayed through movies or television, when they think of seizures, they think of the convulsion, the foaming at the mouth. And to your point, most of the time it is not that, especially for adults. So, how do you gauge personally when talking to a patient or just having the knowledge you have, trying to express to someone that they might have potentially already had a seizure or one of these smaller ones? Because that is something I get asked all the time. Not having seizures anymore, but when towards the end of mine, they were not convulsions at all. And people were like, well, then how do you know you're having one?
Yeah. So one of the questions that I'll ask people basically in a kind of open-ended way, I'll say, has anything weird ever happened to you? and and because the seizures can be sort of these just experiences that happen again and again. And so, for example, one of my patients, when I asked him that question, like, well, no. And then his wife said, well, what about that weird feeling that you get? And he said, oh, yeah, and every once in a while I get this feeling where I'm just pulling in on myself. I'm just pulling in, and it feels like I just can't speak. And it lasts about half a minute. And, that will happen again and again. That was a small seizure. Or people have a really, really intense deja vu. All of us have deja vu. That's normal. But really, really intense, like you can't even leave the experience, and it's the same exact thing. And so, one patient I asked who ended up having epilepsy, I said, oh, have you ever had deja vu? And she said, yes, I have it about 5 times a day. I said, well, that's a lot of deja vu. So people, every once in a while is normal, but having these really intense experiences or out of body experiences. Or another one of my patients, he actually really liked the small seizures he had. They felt kind of good, but he'd feel like he could stretch, his whole body was stretching into space, into infinity. And so, really kind of interesting experiences people have in their own head. And if they keep happening over and over and over again in a really intense way, that could actually be a small seizure.
And when seizures keep happening over and over again, to your point, without treatment, what could be the long-term effects of epilepsy?
So, sometimes when people have the seizures where they don't convulse, they will lose time. They'll be a little bit out of it, and sometimes that can lead to accidents. So they can be dangerous. If you have something where you're just a little bit out of it, and you're standing near a subway track, that could be dangerous. Or you're driving a car. And so we really want to try to identify those before any injuries happen or before there's a larger seizure. And so if sometimes I'll go on, like whether it's Reddit or some sort of social media, and people will be saying, I keep having these experiences. I keep having them. I'm like, oh, you need an EEG. You need to see a neurologist. But having the really, really tiny ones, probably they don't cause any damage to the brain. It's just the ones where people are not aware of their environment or they have the convulsions that are dangerous. And sometimes people have many, many years of the small seizures before they have a convulsion. So I always try to, even if they're small seizures, we do want to treat those with an anti-seizure medicine and try to figure out why they're happening.
And to go back, because I have some other questions for you on your experience and what you're doing now, but I want to hit quickly on the convulsion seizures as well, because I get asked, and I'm happy people feel comfortable asking me this question of, if they are in public and someone has a seizure, what is the right protocol? What should someone think about? Okay, do I call an ambulance? Do I count the amount of seconds that someone is seizing? What would you recommend, especially if it is a convulsion seizure, someone should do and shouldn't do?
hmm Yeah. So if somebody is having a convulsive seizure, yes, call 911 and get emergency assistance. Sometimes it's somebody who has epilepsy and they'll recover and they won't need to go to the hospital. But when you just don't know, it's better to be safe and to get medical assistance. And then you want to make sure that the environment is safe so that they're lying in a safe place. You do not put anything in the mouth. That can injure you, that can injure them. And so it's impossible for somebody to swallow their tongue. It doesn't happen. You're not helping by putting anything in the mouth. Most seizures last less than a minute. They feel like they last longer. So yes, you can look at the clock because it's going to feel like a long time. But besides making sure that they're not hitting into anything in the environment, there's nothing else that you need to do just to get a medical assistance.
And I love how you bring up not putting anything in the mouth, because that is when I get asked that question a lot of times, I'll say, okay, well, what do you think you should do? And the very first thing I hear out of most people is lay them on the side and put something in their mouth so they don't choke. And I'm like, okay, no. Like, don't put anything in their mouth, because I also remember a time, and I tell this story personally, is like when I used to have severe seizures, I could break things with my hands. The power of the human body can be so interesting at times. And you never know when that might come through, especially during a moment in time where someone doesn't have control of their body. So,
Right.
Dr. Mil- oh,
And
sorry.
I'll just add to that anytime somebody is unconscious, helping them lie on their side is helpful.
Mhm.
But, if they haven't had any kind of injuries, first, whether, sometimes you see that people are intoxicated or something like that, or after a seizure, people are unconscious, then would be a time to lie on the side. So I was like, that's fine. Don't hurt your back. But, that can be helpful. Anybody who's unconscious.
Yes, for sure. And um, for Dr. Milligan, as someone who has worked, and you brought this up earlier, with many different individuals within the epilepsy space, you have led initiatives like the Spanish Neurology Clinic to support diverse communities. I'm curious about your perspective on what made the Spanish neurology aspect so important for you to pursue, as well as demonstrating the importance of supporting underserved communities.
Thank you for asking that. So I think one of the things about epilepsy, and it's probably true for a lot of medical illnesses, is that there can be different cultural understandings of the illness, and sometimes they're not correct. And there's a lot of education that can go along with that. And so different cultures can have different understandings. But the bottom line is to try to make sure that I understand and answer people's questions. And so for people who speak Spanish, it can be really helpful to discuss the problem in their own language. And I speak Spanish, so that was helpful to work in a clinic. At the time, everybody spoke Spanish in the clinic, and it was in Boston, so it wasn't like Miami where my friends say everything is Spanish there. But in Boston, it was fewer people speaking Spanish, so we provided care in Spanish. I also worked on the Navajo Nation, And that was a different aspect of epilepsy care with a different culture and maybe different, educational opportunities in those different areas. But the misconceptions about epilepsy, as you said, Olivia, I mean, they're out there. And so sometimes it will come at the misconceptions or come from a cultural kind of misunderstanding, but they could be from any sort of way. And that's one of the things that I really want to help with is for people. The biggest problem that people with epilepsy face, the biggest problem is stigma. And stigma comes from a lack of education, from a lack of really understanding something. And so I try to really, do education. So I enjoy working with different cultures just because it allows me to provide education in ways that maybe people aren't getting it otherwise. But every single patient I see, there's probably some misconception that I can help them with. And so, for example, not in the Navajo clinic or not in the Spanish Neurology Clinic, but just in my regular clinic, a lot of misconception comes when patients are worried they can't play video games because they have epilepsy. Like, well, no, you can probably play video games. It really depends on the type of seizure, but odds are you can probably play video games fine. Sometimes people will worry do I have to avoid spicy food? I say, no, it's fine. Eat all the spicy food you want. Or it may come from one patient I saw, the whole family thought that she had epilepsy because when she was a child, she was scared by a snake and had an extreme fear at that time. And I said, no, it didn't have anything to do with that. And sometimes families are really worried, it had to do with something that I did, that the mother did with the baby. And I said, no, actually it didn't. That didn't, when the patient fell out of the high chair, that's not the reason, And so sometimes really helping people understand and uncovering what that worry or what that misconception is a really important part of my job.
And I think it's so important to break the stigma because you are 100% right. The amount of times, again, there have been times I've heard it and people don't even realize I have had epilepsy in the past and I still get checked for it to make sure we're all good. But I will hear comments or things, and I'm like, that's not even true. But what you're doing by spreading that is hurting the next person that comes up who might be okay for a job, but you're thinking they can't do something because they have epilepsy, or might hurt that individual who just wants to not be what their diagnosis is. And you look at them, and this is also another one of my favorite stigmas I get is you can't go to a club, you can't go to a concert because of the lights. And I'm like, that's not true. Also, if you do have an EEG, and Dr. Milligan knows this well, I'm like, when we get tested for epilepsy through those tests, they're flashing lights very fast at you. In your eyes. I'm like, I could probably outstand being at a concert with those lights longer than you can because of all the tests I've had over the years, where that's what one of the things they're doing to test. But before we touch a little bit more on the stigma, I want to go back to something you said and your work with the Navajos, because as you know, I traveled this past summer to relocate to Alaska, and I got to meet some Navajos. I got to see their community, learn about their history, and it was really amazing and eye-opening to how they're living today, how they lived in the past, their beliefs, but also like what isn't being discussed now. But for you, working in that environment, for example, and there being differences of how things should be treated, right? And things that are looked upon as today's medication versus how their culture does medication and treatments and resources they have. How do you have those? How did you or still do have those kinds of conversations when not only is there potentially a cultural difference, but there's that built-in heritage of beliefs and way treatment should be and all of that?
Yeah, I think that's really important because there are different ways of treating people besides the standard, Western medicine. Besides, that standard way that I went to medical school and learned, there's other ways of thinking about health and well-being and treatment. And so I want to make sure I know what else my patient is engaging in. What else are they doing that fits with their goal of their own health? And some of those things are, I don't know if they're harmful. I don't know if they're helpful, but it's something they're doing. And say, okay, that's good, because a lot of things, it just have to do with us feeling good about ourselves. And as long as that's not helpful, or people take things, I say that's not harmful except to your pocketbook because I don't think it works, but it's not harming you. But I want to make sure that I have that open relationship so that I know what is happening, and really make sure that people with epilepsy take the medication that I'm prescribing. So there are things, that don't harm anybody. Maybe they're helpful because they help with other areas of well-being and health, and that's fine, but it can't replace the anti-seizure medicine. And that's when people can get into serious problems with the seizures. And, rarely seizures can be deadly. But the most common reason that people have really, really bad seizures who already have epilepsy is because there's been a problem with the medicine, where they haven't taken it or it's been stopped for some reason. And so I really want to make sure that I'm open-minded, as long as it's not going to be harmful, but please keep taking the anti-seizure medicine I prescribe.
And that is something interesting. I'm glad you touched upon this. That I recently had a conversation with someone who was doing research on different diets and more of the, for example, carnivore diet versus, eating different things and how to integrate maybe eating more of the meat diet with like having that cupcake. And one thing they actually found research on, and I was like, oh, great, I'm going to be recording with Dr. Milligan. Maybe we'll bring this up. Is the aspect of if you eat more meat centric diet, that if once you've started having epilepsy and you focus on that more diet and cut out more of the sugars, foods, it can reduce or completely let go of you having seizures. And I would love to hear your perspective on that.
Yeah, so that there is a specific diet that can reduce or eliminate seizures in some people. And the diet is called a ketogenic diet or a low glycemic index diet. And so it's really removing the carbohydrates, removing the carbs, and then having more of a higher fat diet. And people are now using that for other things. I think it's gone from being more an epilepsy treatment to other ways that people are using the ketogenic diet. But it's not just today I'm going to eat less sugar. You have to really change your body's metabolism, and you have to stick with that changed metabolism. And then it can have an impact. And so even with people who it works, the ketogenic diet works and they stop having seizures, about half of those people will say, actually, I'd rather eat what I want. Because
I mean, that was my response as someone has had epilepsy. When they brought it up to me, I was like, one thing I think you learn, and I would like I would like your understanding as a physician who sees many clients, patients a day, is for me, someone who went through very severe epilepsy to not having seizures. I understand what it is like not having control of my body or of a situation or needing to be more cautious on things. And I also like my junk food. Dr. Milligan knows this. I enjoy my junk food. And so, like, for me, when they were bringing this up, I was like, if there's something I could do to enjoy my day today without it messing up my well-being, I'd rather have the cupcake once in a while or the soda if I knew it wasn't going to mess anything up. Obviously, if it did, it would be a different story. But I think it's, to your point, important to understand that it isn't a short-term fix. You have to be on that diet all the time and you have to be very regimented about it, but also understand that it doesn't work for everyone.
That's exactly right. And that, again, when we talk about the goals of my practice, the goal is a great life. And if a great life means you want your cupcake every so often, you need that. But I was just talking to somebody this past week. I said, I want you to have a great life, but your great life is going to must have the medicine every day too. As much as you may wish it wasn't part of your life, that medicine every day has got to be part of your great life.
And that was something even you and I discussed because um I had asked you previously, okay, we're seeing all these amazing results, haven't had seizures in X amount of years. The tests are showing all this stuff. Can we get off of it? And you had a very real moment with me expressing just that. And you were like, we know what's happening right now, taking this, and it's all positive things. Life is great. You're doing your goals, this and that. And you said, there's an unknown if you get off the medication. So which one would you rather have? Do we want to potentially go back on things and have some of these struggles and try to find our bearing on it? Or do you want to live the life you're living today? And that to me was very transparent, very authentic, and needed because a lot of times physicians will sit down with you and say, okay, this is the game plan, this is what you need to do, and a discussion. But when you give it perspective, it brings a different level to things. So for you, how do you try to give perspective, not just with patients, but other physicians? Because one thing I have also found is that there are physicians in other specialties who do not have that broad of an understanding on epilepsy or other aspects of that. So how do you try to advocate and share that knowledge with other physicians as well?
Yeah, well, I think that epilepsy is really, really common. So that gives me an advantage in talking to other physicians and other clinicians because, epilepsy affects 1 in 26 people in their lifetime. So everybody knows somebody who has had a seizure or knows somebody who knows somebody. Like it's just so prevalent. And so all physicians have taken care of somebody in their career that has had a seizure. So they have an interest. And so I do try to do a lot of education. But back to what you were saying for your audience, I think it's really important that you find somebody that you're seeing that listens to you, that gives you an opportunity to really feel heard and to have a discussion, because there's a lot that we don't know that or some things that we don't know the right or wrong decision. Sometimes we do. I'm definitely willing to tell somebody you must do this. This is the right thing to do, like take your medicine every day. But there's a lot of things we don't know too. And so having that discussion and that shared decision making and making sure you're seeing, somebody you can do that with, I think is really important.
For you, as you are training the next generation of physicians, what do you try to focus with them on? Not just when it comes to the medical side of things, right? Of treatment protocols or putting in prescriptions, things like that. but the bigger picture, what do you try to instill?
I think it's what I was talking about is really that, you have to really understand the patient's situation,
Mhm.
to understand and to really spend that time, learning and listening. And so it again, that's a big thing to try to convey. But to get back to, like, for example, medication, a lot of people I train, they'll say, well, how do there's over 20 anti-seizure medicines. Which one is the best? Which one is the best? And I'll say, the best one is the one that your patient will take. That we want one that works, but it has to work for the patient. It's not looking at things in isolation. We're not looking at, a petri dish or a lab, animal. We're looking at a person and their whole selves, and then putting our medical knowledge, making use of our medical knowledge. But our medical knowledge is not helpful if we don't understand the person who's coming to us.
Mhm. And I love how you bring up understanding the person. And sometimes people don't tell you everything. So when it comes to listening, but also making sure you're getting that big picture, how do you communicate with a patient when they potentially could be leaving something out and you're getting that feeling? How do you focus in on asking the right questions?
Sometimes people do want, they want to keep things private and they don't feel comfortable sharing it, or they're not sure what's going to happen when they share it. And so some of those things I just know from over time, for what are probably questions people are keeping in their own heads. And I will just, try to do some education around that. And often they involve sex and drugs. Things that are harder to bring up in the doctor's office sometimes, but just along those lines. And sometimes things won't come up the first visit, or they'll come up at the very end of the visit. So I think that's just a normal part of it. So for your listeners, I would say, just to know, if you're having trouble really saying out loud things that you would really like your physician to help you with, that's normal. Write it down. Sometimes it's helpful to just send a message over the patient portal, or come with that information to your visit.
And I think you're right. A lot of times there are aspects of we don't know how to ask the question, or it is no matter who it is, a patient, someone who's providing a service, you don't know how to ask that right question, especially if you're not fully comfortable yet, or know it's good to know you're not going to be judged. But I like how you bring up one of the solutions to that is writing it down, maybe putting it in the portal so it does get answered, because every question is important and we need
Right.
to, and it can be just that missing piece to the puzzle that you need to give good treatment as well. And so even though you might be scared to verbalize it, it is really important to go, okay, what is another way I could communicate this?
That's really great advice.
For you, when you, as you said, sometimes it could take a few visits, or sometimes it's just sitting there and going, okay, there's probably this question in their head. How do you engage answering that, or putting all the pieces together?
So one of the things that we know, for example, for women with epilepsy, a lot of times they're thinking about sex, birth control, pregnancy, even when they're not planning pregnancy, sort of thinking for the future. And so just making that part of what we cover in education. And so sometimes I'm seeing a patient, and that they may be with somebody else. It could be a boyfriend, it could be parents, and I'll talk about pregnancy. Not that you're planning on getting pregnant now, but just so this is a medicine you can take during pregnancy, or do some preemptive education in that way.
And it's important to understand, as you said, with women, especially in the society we're in, talking about kids and having kids down the wrong road. It's always something on the table that people, once you, I feel like, hits an age, that it gets brought up. So it's important to understand because that's even something. And to your point of education and how things can change and we can learn more over time, being very transparent, when I got epilepsy, the medications that were out there and the knowledge that was out there, it was not the same that it is today. And I remember having discussions when I was young of like, okay, what could be side effects? Mainly my parents, because like I was 9 years old. I was not asking these questions. Of like long-term side effects and this and that. And there was a lot of side effects of things to be aware of like once you hit puberty or long-term effects with childbirth. And then years later, we're discussing same medications, different medications, and you're like, no, there's now been all this research. This doesn't affect it. This is where this stands. So it's important to understand that even if time has passed and you're nervous about certain things, to ask the question, especially for females, advocate for yourself because what you might have heard 10 years ago, especially if you've been diagnosed with anything, it can look very different 10 years later. And the research that could be out there on the topic as well.
Yeah, and I'll just mention to your listeners, for women with epilepsy, if you've been told at some point that you shouldn't have children or you can't have children for whatever reason, seek a specialist, see an epilepsy expert. I've seen so many women who've been told that in the past and that they've got beautiful families now. So please see an expert. For men and women who have sexual dysfunction, see an expert. Sometimes it's related to something that can be treated. Sometimes it's related to the medication. So another really important part of quality of life and health. So see it, bring it up and see somebody about it.
And that's a great point because I remember when I was younger, and the only medication that really worked for me was Depakote. They had the discussion of being on it long term and then the likelihood of not being able to have kids about it. And I always remember that one statement being made one time and being in the back of my head. And again, I was like 10 years old. So at that, I don't even know what's going on at that age, let alone be thinking about it, right? And all these years later, I was like, okay, the likelihood this could happen because I was on that medication for so long, this and that, and I was told this, it would be difficult, potentially not likely. And then we had a discussion, and it was like, that's not even the information that's out anymore. That isn't the case. And I was like, "Oh, wait, so all these years I had this thought that the likelihood of this would be, uh, less likely for me or have these challenges, and, that isn't the case due to that." I'm like, "Wow, what a burden has been lifted off just because the conversation was had." And so that's, to your point, seeing a specialist can take fears or things we've heard in the past and be put to rest. And it's so important to do that, not just for yourself, but also for your mental well being long term.
Yes. Yeah. Really important to ask those questions. And there's some questions that I know are really, really common questions out there. And the flashing lights is the number one question out there on social media. We did an analysis of all of the posts that people put about epilepsy and seizures, and the flashing lights was the number one. And yet that only affects 3 to 5% of people with epilepsy. So, there's these misconceptions about whether it's medicine or pregnancy or flashing lights, whatever it is, that there might be a big burden people are carrying around with them that can be taken off their shoulders. Or if it's true, you're dealing with the facts then. but important to ask the questions.
So this is going to be my last question because sadly we're at the end of our time and I'm going to have to wrap up. But bringing up the misconceptions, the flashing light, what are some of those other misconceptions? And can you take a moment to debunk some of those for us?
Yes. So the number one thing is if you have a history of seizures or if you have epilepsy, just living a healthy lifestyle. That's what you need to do. Nothing else. Don't have to take any, live a healthy lifestyle. And if you need to take medicines, take the medications. We want to get rid of the seizures completely. But some of the common misconceptions, and honestly, people have asked me these questions. Is epilepsy contagious? No, it's not. Absolutely not. 100% no, not contagious. But that is an important one. And I saw a patient who had a stroke, unfortunately, and he had epilepsy because of a stroke. And I finished the whole visit with him. He left. He went in the waiting room, and his girlfriend came back in. She knocked at the door, and she said, "I just want to ask you, is this contagious?" I said, "No, it's not contagious." So I think that's a really important thing to realize. There's a lot of different causes, but it's not contagious. The other thing is that people who have epilepsy can live completely full lives, can work. Many people can drive, have families. And so for half of people who have epilepsy, I'm telling you, audience, you would just never even know it because they take their medicines and they never have a single seizure. Some other people, we have to do a little bit more work with the neurologist to get the seizures under control. So it's a very small percentage of the people who are having uncontrolled seizures. But even people with uncontrolled seizures, they want to be treated normally. And that's really important. I used to work at a camp for children with epilepsy. They loved going to that camp because they could just be themselves and didn't have to deal with all the rest of us with our judgments and our stigma. And so for the audience to keep in mind, that is the number one problem facing people with epilepsy is the rest of us and our judgments and our stigma. So I think that's important for people to realize.
Well, thank you, Dr. Milligan, for all of your insight today. I find it so rewarding to hear not just about your journey and how you're making an impact, but really sharing knowledge and tidbits about so many different areas of epilepsy.
Well, thank you so much for having me on your podcast. It's my pleasure to be here and to see how well you're doing.
Well, thank you. And a few of our key takeaways from today's conversation includes most adults who have a seizure are not shaking seizures. So they're staring events. They're different types of seizures than what you see in television and movies. As well as Dr. Milligan said, most seizures last less than a minute. It can, like she said, it could seem like a very long time, especially if you're not used to seeing them or knowing what to do, but most of them are less than a minute. But it is important, to her point that she made when we discussed this, to also time them because it is good information to have to know where your seizures fit, as well as epilepsy affects 1 in 26 people in their lifetime. Take note of that. You're in a classroom, you're in a study hall, you're in a workout class. Most workout classes are about 20 to 30 people. Someone in that room, whether they know it, whether they don't, have probably had a seizure once in their life. And as Dr. Milligan said, if you haven't had a seizure personally, you know someone or know someone who has had one, as well as find a physician that will hear and listen to you. And for the physicians out there, be the physician that hears and listens to their patient. Because as Dr. Milligan mentioned throughout this episode, it isn't just about fixing a problem and helping your patient meet their goals, but it's being able to sit there and listen and also fill in the gaps sometimes to give the best treatment, whether that is a adding holistic and medicine, just the medicine, but also being able to answer the questions that a patient might not be fully comfortable asking, but know what's on their mind and gauge the conversation like that. As well as a fun fact of flashing lights only affect 3 to 5% of people who have seizures. I love that Dr. Milligan brought this up because it is so true. And like she said, something that gets asked all the time and such a stigma, as well as epilepsy is not contagious. And I want to leave the listeners with one of the biggest takeaways that I think we heard today through everything Dr. Milligan has said is be an ally, be a friend, be understanding. Do not put stigmas or misinformation on individuals who have epilepsy, who might be going through figuring out treatments themselves. Do not allow the word epilepsy to scare you or to put any misconceptions on anyone else, because it is just a part of their story and their journey. This was a great episode with our top-notch guest, Dr. Tracey Milligan. Thank you for listening and have a successful day.